Hello everyone, my name is Jennifer Wright. I'm a student at Roberts Wesleyan University in the Master's in Nursing Leadership and Administration program. This is my presentation on the importance of evidence-based nursing practice based on the article Setting the Climate for Evidence-Based Nursing Practice by Sonia Udad program. So evidence-based nursing practice truly is promoting the best practice within the nursing world. It is ensuring clinical decision making is guided by the best available research, clinical expertise, and patient preferences. Nurse leaders and nurse managers play a key role in promoting the use of evidence-based nursing practice that will be discussed later in this presentation. And this purpose of this presentation is truly to understand the leader's role in implementing evidence-based nursing practice within the nursing world. With utilizing evidence-based nursing practice, it is moving nursing away from traditional practice or doing things a certain way because that's the way it's always been done, and moving practice towards patient care that is based on scientific research data that is scientifically proven to improve patient outcomes, improve patient safety, which will then enhance clinical decision making and help utilize research management more successfully. With the promotion of evidence-based nursing practice, it has been shown and proven to do things such as reducing hospital stays, the length of hospital stays, reducing unfortunate hospital events such as pressure ulcers or hospital-acquired infections. So there is a research study that was mailed out to nurse managers. It was mailed out to around 400 nurse managers, and only 144 nurse managers completed this study. And this showed concerning data regarding the nurse manager's outlook on the use and application of research and evidence-based nursing practice within the manager role and within the nursing culture. It showed that the utilization and application of research was not a common practice amongst nurse managers, and it showed that research was graded as a low concern from nurse managers, which again is very concerning regarding how nurse managers, based on this study, think of and utilize research in nursing practice. So what is evidence-based nursing practice? Evidence-based nursing practice is an ongoing process that utilizes research to identify the best practice regarding different care situations. And this helps inform and ensure patients are receiving the best care possible. It eliminates the reliance on old traditions in doing the way things are being done because that's how it's always been done, and moves it towards evidence and practice that is based off of research and what the data and evidence is being shown to support best practices. This methodology does improve quality care and increases patient and staff satisfaction. There are a few barriers to evidence-based nursing practice that was identified in this article, and these barriers were broken down into three separate categories: the individual, the organization, and the environment. The nurse manager might not know how to perform a literature search. They might not know the importance of evidence-based practice and promoting that amongst their team. If the nurse manager is not required to be a master's prepared nurse, they might not have had this education on the importance of utilizing evidence-based nursing practice to improve patient outcomes. There's more demanding workloads. Patients are sicker. Nurse-patient ratios are at a very high rate. So nurses don't have time on the unit when they're at work to perform these literature searches, and they might have low motivation to do this work outside of their working hours due to the high stress and high demands of their job currently. Within the organization, not every organization is affiliated with a teaching hospital. There might not be a database that is free for the staff to use. There might not be a librarian that could walk the staff through how to perform a literature search. And a literature search to someone who is not trained to do one is very overwhelming, putting in a few key terms could bring up thousands of articles, and they might not know how to tailor that down to what they're looking for. And they might, again, not have time dedicated to perform a literature search if they are a staff nurse and not someone who is at a higher level. With the environment or the culture on the unit might not support changing practice, using research to change this practice. They might be so used to the tradition that there are a lot of barriers to implementing evidence-based practice just based on the culture of the unit. That could be a barrier to the use of evidence-based nursing practice as well. And it truly is the manager's role to identify barriers to implementing the evidence-based practice and working amongst those barriers with their team to promote best practices for their patients. Nurse managers and nurse leaders truly do play a very important role in promoting the use of evidence-based nursing practice within the healthcare organization. Managers should encourage the use of evidence-based nursing practice and should encourage the bedside nurses to identify areas where care could be improved upon. It is the bedside nurses who are doing the care on a day-to-day basis who could identify these inconsistencies and question why things are being done. So it truly should be starting with the nurse manager, encouraging these nurses to have a questioning type of a culture into why things are done the way that they're done, and ensure that this is based on research evidence and not on tradition. Nurse managers can help enhance and encourage a collaborative environment by activities such as doing a journal club on a monthly basis with the nurses on the unit or within the clinic, where nurses can share, discuss, and identify areas where care could be improved. And it really is a responsibility of the nurse manager or the nurse leader to identify the importance of evidence-based nursing practice for nurses on the unit and in the clinic. And nurse managers and leaders could identify areas where there could be development or career development opportunities for nurses, to where maybe they have a certain amount of set hours within a time block that could be set aside to complete research. There could be learning opportunities for nurses, potentially classes to take where they can learn how to perform a literature or database research to identify best practices. In regards to patient outcomes, nurse managers and leaders should be promoting their nurses again to have a questioning culture. Question, why are things done this way? Is it because it's how things have always been done? Or is there a solid evidence-based scientific reason backed by research as to why there are certain processes completed the way that they are? Nurse managers and leaders should also ensure that staff have the resources necessary. Make sure they have the ability to have internet access, a librarian that could potentially help them. Time set aside, again, away from those patient care hours, where they can utilize their time to perform research searches to identify the best practices and ensure that they're following these best practices. And again, advocating for the nursing staff to be supporting and utilizing evidence-based research and evidence-based nursing practice in providing patient care, ensuring that the care they're providing is based on scientific research data and not based on tradition alone. In conclusion, nursing leadership does play a very crucial, critical role in identifying and promoting the use of evidence-based practice within the healthcare organization. Leaders are responsible for leading the organization, creating the culture that is based on evidence-based nursing practice, and understanding the use of research in identifying what the best practice is. It's important for the nurse leader and manager to cultivate a culture that promotes evidence-based practice and is not practicing solely on tradition alone, so the care they're providing can improve patient outcomes, improve patient safety, improve staff and patient satisfaction, because their care they're providing is not going to be based on tradition. It is going to be based on scientific research evidence. And this is the reference for the article that I used during this presentation.